So this is George, and we're going to demonstrate some of the techniques on George for waste elimination. Now, before we start, it's really important that you've got some equipment to hand. A bowl of water for washing. We've got some dark towels for the bottom half. We've got our PPE, so we've got our hand sanitizer, our gloves and our apron. We have a bag to put the soiled waste products in. And then we should have clinical waste bags for disposing of clinical waste, so faeces and urine. Now, if you're in a care service, you'll probably have red bags as well, and red bags would be used for soiled linen. And then that way we know if we're going to put our hands in something, we know that actually that red bag is for soiled linen. And normally red bags go straight into the washing machine and they dissolve as the washing is being done. So let's start with George. Now, George has just told me, Steve, I need to use the toilet. So the first thing I'm going to do is wash my hands. So I'm going to put a little bit of gel in the middle. I'm going to go through. We're going to knuckle shuffle, and we're going to go around our wrist. So by the time I've finished, my hands should be dry. I'm then going to put gloves on. Now, gloves are really important when we're dealing with bodily waste for infection control purposes, transferring of things, of bodily fluids, and you don't really want to be touching other people's urine or faeces. And I do see carers quite often care without gloves for bodily fluids. It's really important we put our gloves on. Again, aprons, because we don't want to transfer bodily fluids around. So good PPE when dealing with waste elimination is really important. So we'll pop our aprons on as well. Now, it's important to ask George, when he says I need to use the toilet, it's important to ask what does he mean by that. So George, you said you wanted to use the toilet. Is it to urinate or do you need to open your bowels? So again, I'm using appropriate language for him. So let's just say, for example, he said he needs to urinate. Think of ergonomics, think of the working height. So the first thing we're going to do is bring George up in bed. Now, as we do this, it's really important that we think about his dignity. So if you have curtains, etc., it's important to close these as well, because we don't want people looking through and seeing George urinate. Now, because he wants to urinate, the first thing I'm going to probably recommend to George is the bottle. So George, have you used the bottle before? Yes, good. So what we're going to do, we're just going to pull the covers back and we're going to allow him to sit up a bit. And if you've got your underwear on, you can go through the underwear and you get the penis out. Pop the penis into the bottle and then that should sit there quite nicely. Now, it's useful, you can always cover him up for his dignity and allow him to use the bottle. And at this point, as long as he's safe, I would say, look George, I'll give you a couple of minutes and I'll come back. So I will go away and then I'll come back. Now, when I come back, it's important that we clean the penis to make sure it's clean so it's not smelling. So the first thing you can do, you can get a wet wipe, pull the penis out and give it a wipe. Okay. And again, if you've got some tissue, you can dry that there. We can give it a little shake and then pop that back in. We put the lid on the urine bottle, we take the towel over the urine bottle and we take that away to drain, because George doesn't want to see his waste. You know, let's think about how we would feel. He'd be embarrassed already. So the more we can keep it discreet, the nicer it is for George. So once we've got that, again, we can see how much fluid he's passed. And we should be thinking about how much he's had to drink today. So maybe today he's had 4 cups of tea. So he's had about 1,000 millilitres. So he should be past at least half of that through urine. Now, when we look at the urine, there are different colours. So if it's clear, then we're going to assume that he's had a good fluid intake. And if it's dark and concentrated, then we're going to assume he's not having enough to drink and he could be dehydrated. So it's really important you look at the colour. Equally, when you tip it out, you may smell the urine. Now, if the urine's offensive and strong, it might indicate that he's got an infection. So it's really important that you look, and if you can smell the odour from the urine, just bear that in mind. Okay, so that's the bottle. Now, let's assume George is Georgina and we need to use the female bottle. So again, same principle, but we would place the bottle over here. She would be able to use that and then fill it up. Again, we would take it away, we would wipe, we take the funnel off, we pop the lid on and we remove that. And again, good personal hygiene for urination. Okay. So, imagine George is always incontinent, so he's unable to move and therefore he can't call out, he can't go to the bathroom, and for long periods of time he's going to be on his own. That's going to mean he's going to be laying in either urine or being in a wet pad. Now, what we have then got are catheters. There's two types of catheters. There's the catheter that goes down the urethra into the bladder, and it's like a little ball and it blows up. The urine comes down a tube into a catheter bag. Alternatively, we use the convenes for men because they're less invasive. So I'll just run through how to use the convene. Now, again, for the convene, you're going to need to put your gloves on and you're going to need to make sure that your bag is sealed, so it's not been tampered with. You're going to get your convene, which is in a box, and again you want to make sure that it's not been tampered with and the seal hasn't been broken. So, we're going to place the towel over George and we'll get his penis out. We're going to open up the convene first. Okay. And it looks a bit like a condom with a filter. Okay, and you've got your blue strap. Now, the idea is, like a condom, it's going to go onto the penis and we're going to pull down using this and it'll roll down. So the tube is on the upside. So we need to pick the penis up and we need to hold the top and roll. We use the blue pull and it pulls down. Okay, so you can see that it's got a sticky part on the inside and you need to make sure that that's stuck all the way around. So actually if I've pulled that, it's not going to come off. We're now going to open up the catheter bag. In the corner, and we're going to put it. Now it's really important that these are sealed for infection control purposes. So, once we've opened up the bag, you've got your tube with your cover on the top, and you've got the bottom, so where we drain. And you'll see that there's leg straps for here. Okay. Now, if you're laying the patient in bed, there's little hooks that would hook this to the edge of the bed and then the tube would feed in. Or alternatively, you can apply it to the inside of the leg so the tube's not compromised. Now, all you simply do is take the lid off. So we just pull the lid off and we attach the tube into the convene. So if we give that a little tug, you can see that that's not going to go anywhere. And you need to make sure that it's rolled all the way down so it's tight. So now you've got the convene onto the penis. If he urinates, it'll go into the tube, and into the bag. Now, make sure that your clip here is in the upright position, so that's locked. If you leave it open, the urine will just run out, and we don't want that. So we make sure that that's closed, so in the upright position. Now, if we then wanted to drain the bag, so we come to our patient and we see that the bag's full, all we're going to do is we're going to get our bottle, we place the catheter in the bottle, and we open it to drain. We give it a little shake, and again, you can get your wipe the end clean, close, you can pop your cap on, and it stops any leakage. And again here, we'll take our bottle and take it away. So that's how to use the convene. Now, catheters work in a very similar way. So the only difference is with a catheter, rather than it going over the penis, it goes through the urethra. So if we take this off, a catheter would go straight through the urethra and into the bladder, and there's a little ball that blows up and it sits in there. So again, what you will see is a plastic tube coming out of the penis like this with a little hook, and the two just connect, so it's the same thing. And that's no different to the female catheter, so that's fine. Now, with a convene, it's important that these are changed daily, and it's really important that you clean the penis as well. So that's how to use your convenes. Now, the bags can be changed easily just by taking them out and putting them in. Okay. That's the end of the urine for using the equipment.